I'm here with Kathy and Sarah, who are mindfulness practitioners involved in health professions education. Let's listen into their conversation as they discuss how to use some of these mindfulness principles in pre-licensure nursing education.
Well, you know, Kathy, in the clinical setting, I really encourage students to take a mindful moment before entering the patient's room. I find that that's one strategy that helps students to release some of that anxiety and tension they often feel as they are beginning to work with patients for the first time. And a mindful moment involves just pausing, taking a breath, and then taking a few more deep breaths and really pulling oneself into the experience of the moment and clearing one's mind and allowing oneself to let go of everything else that's going on around them so that when they do enter that room, they're fully aware and attentive to that particular patient.
Mm. There's a lot in what you just said that I really feel connected to. And nurses certainly are not either in their educational environment or work environment supported in that way of being. We're praised for being right. We're praised for multitasking. And there's this delusion that it actually gets more done when it doesn't. And yet we know that there are data around the fact that a sense of certainty leads to mistakes. Yeah. A narrow conceptual understanding of what's needed and what's right in this particular situation. And so to have the support, from a clinical supervisor or a teacher that, actually acknowledging a sense of uncertainty can serve one is quite supportive. And it allows us to have critical thinking, so we're not certainly abandoning training. Mm-hmm. That's already woven in. But it allows the critical thinking to be less constricted by the tension of needing to get it right, which in opening that allows some flexibility. So a more creative response rather than an autopilot reaction comes up. And it actually is more accurate and ends up being more right without striving to be right. So that pause is so important. It's pregnant with intention. I choose to be here now. And first, and we often have the understanding, I want to be here for this patient. But we skip being here for this person.
Right.
This person who might be suffering from worrying about a sick child at home or about one's performance, about a conflict with another coworker, all the rumination that's going on in the background. Mm-hmm. We forget to notice what's going on in the body and just, that dropping in you're talking about, of just dropping into one's own body. Oh, wow, my shoulders are up to my ears, breathing shallow,
Yes.
know. And connecting with that breath. I choose to be here in this pause. I choose to be here for this patient. It doesn't take that long. We're already breathing, So I choose to be here in this place. That actually allows us to tap into our wisdom, our creativity, the compassion that wants to serve this patient in the first place. And we can't be here if we're not intentionally here.
Absolutely. And it's really acknowledging all of that and being aware of it that then gives us this release and this ability to let it go, which really brings us presently into a moment with a patient so that we can listen and hear their story and let go of preconceived judgments, which is so easily we often slip into at times in nursing practice, I think.
Absolutely. Especially when there are time constraints, what Pat Ebright talks about with the complexity of work. There's so much going on, and we're trying to multitask in our heads, even though it's delusional. I mean, neurobiology shows us we can only have our attention in one place at one time. And yet we have this scattered thinking that doesn't get more done, it gets less done.
Right.
So we have to recognize what's here. And I think when we're hurried, it's very easy to look at a chart and see, Mrs. Smith, coronary artery disease, diabetes, early Alzheimer's. That story, that concept, if we're not aware how it's framing our capacity to be in connection with Mrs. Smith, then limits our capacity to be with Mrs. Smith. So we might miss subtle signs of other modalities that are, not on the chart. So, and make mistakes because of that. So it's that intentional open-mindedness and flexibility, first with kindness for oneself, that allows compassion and kindness to be there skillfully with the patient. So I really appreciate that.
Well, from my experience, mindfulness is best learned through a combination of discussion and reflection and a regular meditation practice. And I think in the video we've just watched, we've learned a lot about the importance of a regular meditation practice. But in pre and post conferencing with students, I've had a lot of good experience with creating meaningful discussions and reflections around clinical practice. And students at first are a little bit resistant to that. They might see it as just a place to come and bring a problem for the day, or another time we have to talk about this situation one more time. But it's usually about the time they have their first really complex situation that's a bit overwhelming to them. Then they're really ready to share that experience and get to understand it better because of the complexity and being a bit overwhelmed. And having an opportunity and a safe place to reflect and discuss complex clinical situations, and all around the concepts we've just talked about in a non-judgmental way, and being fully present to this patient and this situation and all the complexity around it really helps students to expand their thinking and over time develop a different point of view.
And just having the safety of that container modeled by you or any other clinical instructor that has a mindfulness practice, I think is very important. It's difficult to discuss anything that's emotionally charged when, again, does that make me seem weak? Does it make me seem like I'm not a good nurse? Even the resistance you're talking about to discuss it. The great thing about mindfulness is all the doors are open to what Rumi calls the guest house. Whatever's here is here.
Right.
And so if resistance is here, resistance is here. What does that feel like in the body? How does contraction around that resistance keep me from the connections that are so important here in this clinical and interpersonal interaction? So, that modeling is so important, and particularly if students do have a mindfulness practice, then just the reminding, let's check in right now in the middle of this. The person who's talking obviously has the integrity and the honesty of expressing the distress that's around this. How is this for everybody else in the room?
Right.
Check into your own body, your own heart. And to know that it's not woo-woo. I'm a scientist too, and there are data around this. This is scientifically based. There are a few small studies with nurses, and I so appreciate those researchers who are working with nurses and physicians, medical students, nursing students in this, because there's not much that isn't emotionally charged.
Absolutely.
And yet that emotion, when unrecognized, can actually cloud clinical judgment. When it's acknowledged, it opens our space and our capacity to be with it. So that check-in in a pre-conference, I think, is going to be more valuable if a student already has a practice. And that's one of the things I love about MBSR, is because it's so embodied. One comes to really know the tension and recognize, in kindness, gosh, there I am again. What's here? What's here with that? In a very a self-kindness that we're not used to. We're a lot kinder to everybody else than we are to ourselves.
And to be able to do that in a pre and post conference situation together with one another really helps to build that collaboration among professionals from the beginning, and to be able to share openly and honestly with one another these experiences is an opportunity for us to role model that collaborative process and that sense of openness with one another that I think is really important to effective patient care and also patient safety.
Yeah. A really supportive environment. And it supports collaboration in communication.
Absolutely.
Not just within the pre-conference, but on the floor. Nursing assistants, physicians, housekeeping, respiratory therapy, whatever, social work, whatever it is. The capacity to pause, again, bringing intention, recognize what's going on in the busy mind, which is always busy, and the tense body, and really bring this intention to listen deeply, to speak the truth of the present moment, and really trust what's going to come out of that, rather than having what you spoke about before, which is this agenda. If I'm trying to get from point A to point B, I might be able to, because of my communication skills, move the chesses on the piece board, and or move the chess pieces on the board, and get where I want to go. But in doing so, I've missed everything to the side.
Right.
That's not on the line between point A and point B, and so I've missed lots of opportunities in communication. And so, to have that within a pre-conference or a post-conference supported in that safe container with other nurses, then gives that support in other collaborative mindful dialogue places that, again, it's going to enhance care.
Yeah, I think that's a really important point, Kathy, that mindful communication really is what you just said. It's dialogue. And dialogue is one form of communication that's really about listening and attending to ourselves and the other person, and opening ourselves up to integrating multiple points of view, looking at multiple points of view, respecting and acknowledging ourselves and the other person. And that's a really specific form of communication that's very unique, I think, to mindfulness. And mindfulness is dialogue when it comes to applying it to our relationship with another person.
If I can see a coworker, a nurse physician, nurse assistant, coming towards me, and recognize in my own head the thought, oh, here comes trouble. If I can recognize that thought in kindness, oh, interesting. Set it down just because I've recognized it.
Right.
And then really open myself to this seeing, this hearing. Know the story and set it down. Because if I don't recognize the story, I'm not setting it down, and I'm presuming what's going to be happening, and therefore I'm not hearing what is happening.
Absolutely.
So it makes a huge difference. And again, it's not done in some sort of a way that's self-critical or other-critical, but a lot of kindness.
Towards ourselves and the other person.
Absolutely.
Yeah.
As I'm sitting here, something that's coming to mind that is pretty pragmatic about this practice is that often, whenever the topic of mindfulness comes up, the capacity to be compassionate, self-compassionate, those two things really not being different, to be connected with the patient, connected with oneself, to be mindful, everybody nods their head. Yeah, this makes sense. This is how I'm going to be. But it's not what comes up in the middle of a lot of stress or something that's emotionally charged. Our old ways of being, our autopilot reactions come up. We all know that too. So, and a lot of people say, this is great, this is wonderful. I just don't have time for it. I don't have time to, learn a practice, to go to an MBSR class. So I'm really curious, as a nurse educator, what your thoughts are on how to encourage people to step into this.
Mm-hmm.
The science is there, but it's an experiential learning. It's not a book learning.
Right.
And I don't know, maybe you'd want to, I don't know how you feel from your personal experience
Yeah.
about that.
Well, I think that's an important question, Kathy, because to use this effectively with students, it really requires me to have my own meditation practice and have my own time that I set aside each day to bring myself into the present moment. And to be able to have that sense of openness and clearing and presence myself, because the students really pick up on that. They know if I'm being present with them, and I have to be able to model that, and that it doesn't come, like you say, that's not automatic. That's something that requires practice, because what's automatically is the doing. What's not so automatically is just being. And so it's important for me to have a sense of being. And the students pick up on that pretty readily, I think. And that non-reactivity that they see in me, that when something does happen out of the ordinary or unexpected, or some sort of critical incident or event happens in the clinical setting, they know that they don't have to worry about me getting angry or mad or reacting negatively to them, that I am going to be present. And often they find me non-reactive and wonder what that's about, but it usually involves me asking more questions and getting a better understanding of their experience and what's going on and all the factors that played into whatever incident it was that occurred. So it's me being able to role model what they want to be, what we want them to be doing in practice. And I can't do that if I'm not engaged in my own mindfulness meditation practice. It's a really important point. So, and it doesn't necessarily take a great amount of time. It may take getting up a little bit earlier in the morning, or staying up a few minutes later in the evening, or just setting some time aside during the day to close my office door and take a few moments to just bring myself into the present moment. But through practice and time, we learn to take the time to bring ourselves fully into the present moment before difficult meetings, before difficult student interactions, before challenging professional circumstances. It becomes a way of being, but like you say, it requires practice and a commitment, and not as much time as you think.